Right. Hi, Shahin. It's good to see you. I know the last time we spoke was probably the end of May, June time for an INFOCAST, and then we were really old-fashioned then because it was just the voice thing. So now we've gone to voice and visuals, which might encourage people to sort of either turn off or not. I'm not too sure. Shahin, can we just because many people will know you, but just introduce yourself and why we're specifically talking to you about COVID-19 and children with PH?
Yes, of course. Thank you for having this interview. I'm Shahin Moledina. I'm a primary hypertension specialist at Great Ormond Street Hospital, and I look after children with primary hypertension.
So Shahin, a lot's happened in the last sort of 5-6 months, and a lot continues to happen. And I must say, sort of setting a benchmark here, there's no absolutes in these questions that I'm going to ask you. So please don't feel obliged to say yes and no's because things change and we know there's no absolutes. But can you just summarise as best you can where you think we're at with the COVID-19 situation? And we are talking specifically about children here, you know, where you think we're at from our last conversation. So our last conversation, we got into shutdown and shielding. Where are we at the moment? What would you sort of say? This is where this is what's changed or what we've learned broadly.
Iain, you're absolutely right. There are no absolutes, and we're all still learning day by day, both scientifically and just as a community of people. But things have developed over time, and the whole community's been adaptive through that process. We went through a period of quite a high prevalence of COVID, matched with a lot of anxiety, obvious anxiety about COVID and shielding, which was a challenge for people in its own way. Mm-hmm. And then we went through the phase of coming out of shielding, which was also psychologically a challenge, and we had to learn how to do that. Then we've had August, which hasn't been normal, but hasn't been the same as the previous months.
Yeah.
And now we were going to do this interview last Friday, and we're doing it today, and already things have changed in that time.
Yes. Yeah.
And we're seeing the case numbers going up again, just early days at the moment. I think what we've learned specifically for children, we don't have all the answers, I'll be honest with you from the beginning about that, but what we learned is that on the whole, health, not just talking about children with primary hypertension, just on the whole, fortunately, children seem to be much more resilient to the virus than adults do. And by that, I don't mean that they don't catch it. I mean that they just don't seem to become as unwell as adults, or as unwell as frequently as adults.
Because it's true, isn't it, Shahin? I think, I mean, correct me if I'm wrong here, that one of the things we've learned over the last 5 months is the people most at risk of having really serious complications with COVID have been the much older, not exclusively, so, the much older population, those with other health issues. So they're the ones who have struggled to successfully fight the COVID vaccine, the COVID virus. Would that be a fair assessment?
I think that's right. That it does seem that on a population level, the biggest risks of being older, probably being overweight and being male, mm-hmm. after age, and then having significant health conditions as well.
Okay, well that's helpful as a resume. So how things change from your perspective and your team's perspective, because I know there's a really good team behind you as well at Great Ormond Street, particularly in the PH field. How are things different there now at the moment as far as of living? You providing a service for people with pulmonary hypertension, children with pulmonary hypertension, and the families. Are you doing things differently now than, and how long do you think that might continue? What people can expect?
Yeah, so we've obviously, just like everybody else, we've constantly tried to adapt our service. There's always been a service for for children. So although it will change in how it looks, it will always be there. There'll always be, and if at every point through this, if a child needed to be admitted to hospital, if they were sick, if they were a new patient, they would be seen, and whatever they needed, we were fortunately able to provide them. So I want people to be reassured about that. Of course, we didn't want to, and we don't want to expose people unnecessarily to travel if they can avoid it. And that's allowed us to innovate and find new ways of doing things. And actually, I think that's been very welcome by patients and actually by us. And I think there are lots of things that we'll keep from that. So effectively, at the moment, what we're doing is, if you need to be seen, if you need to be admitted to hospital, you will be admitted. There is space, it's clean, and you'll get what you need. Mm-hmm. If you need to be seen face to face, we have the capacity to do that. And here we are running a face-to-face clinic. If we normally see patients face to face in a shared care clinic around the country, at the moment, we're not traveling to those shared care clinics, okay, but all of our shared care partners have, without fail, been very supportive, and they've been able to provide local input as required for patients. So if a patient needed to come to clinic face to face because they needed an echo or someone to check them over, they could still have that at their regional centre. And then our shared care colleagues have been sharing that information with us, sending us the pictures, and we've been able to do video consultations with the families. Mm-hmm. So we have a hybrid system at the moment, inpatients running as normal, face-to-face clinics at GOSH are available. We're running them in a socially distanced way and fewer slots. Mm-hmm. And people will wear face masks. And we ask that there's only one adult per patient that accompanies a patient. But what I think everybody will be pleased to know is that we found ways to replace some of those face-to-face clinics and still have just as good a consultation over video. So if you don't need to come face-to-face, then there's no need to drag you away from your house or away from your life to do that.
I think it's true that one of the things that COVID's done in healthcare is that it's accelerated looking at new ways of supporting people, particularly in rare diseases. So it's not because of COVID, this is why we're doing it, but we were probably already looking at it, and now COVID has accelerated that possibility of using that technology, and we become a bit more familiar with it.
That's absolutely right. Yeah.
I think the other thing, as you said as well, Shahin, just to remind people that going into hospital, if that's a necessity, and it's, so people are considering, not just everything, is that hospitals are much safer places than because we've got systems in place over these last few months about clean areas and those sorts of things and the social distancing. So just to give people confidence that the systems, if people have not been to a hospital for the last 6 months, they're very different places now than they were then.
That's absolutely right. So I think also to reassure people, if people are concerned that they're not well and they need to be seen, they shouldn't delay or worry about contacting the team to arrange to be seen. There are ways, we've all adapted and found ways to see people safely.
Yeah. A big question here, Shahin, now, and because we're in September, children going back to school and things like that, bound to sort of generate a new level of concern and questions. And as you said right at the beginning, there's no absolutes of this, but what are your thoughts or answers to, I have a son or a daughter with pulmonary hypertension going back to school, things I need to think about? What's the advice from your perspective?
Yeah, you're absolutely right. That's a very pressing thing in the beginning of September, and we've had numerous conversations with numerous families about just that. And I know it's very difficult for families to try and juggle up everything that they're hearing on the news and go from a few months ago feeling that you had to be in your house to now being told that you can do all of these things. So the other thing that we try and bear in mind when we're having these conversations with families is that every family has their own unique situations. You know, you've got siblings to think about, you've got parents, or other family members who have different needs. They might need to go to work or not. And children have a differing sense of whether they want to go back to school, or how desperately they want to go back to school. I think a lot of children are champing at the bit to go back to school because they're missing their friends and they're missing the emotional and support and camaraderie that they get from their peers. So we've got to bear all of that in mind. So effectively, I think what we're saying is that we're a bit more reassured now than we were before that children, although they're probably still more children with primary hypertension, although they're more vulnerable than healthy children, they're not perhaps as vulnerable as we had first feared. We still recommend that children with primary hypertension are considered, you know, I think the government has two classifications. You're either everybody else or you're extremely vulnerable. Mm-hmm. And we're still saying that children should be classified as extremely vulnerable. But the advice at the moment, because, and this changes on a day-to-day or on a weekly basis, depending on how much transmission of virus is around, is that people who are vulnerable can go out, go to work, go to school, but they need to really take the public health precautions very seriously. And employers and schools need to make adaptations to permit them to go back. I think we'll probably talk in a minute about what kinds of adaptations families should do and what kinds of adaptations employers and schools should do.
Yeah. Can I just do a check of a fact here, because I know it's one of the questions that, and you described are children with PH more likely to catch the virus, or are you saying something different, that if they caught the virus, that's when the challenges? So are they more likely to catch the COVID-19 virus?
No, thank you for trying to clarify that. We don't think that they're any more likely to catch it than anyone else. But the vulnerability we're talking about is, if you catch the virus, are you more likely to become unwell with it than if you didn't have primary hypertension? So we don't think children with primary hypertension are more likely to catch it. We do think that they're probably more likely to become unwell with it than healthy children, but probably not as likely to become unwell as an older adult with primary hypertension.
Okay. You mentioned quite eloquently there, Shahin, going back to school or even in adult situations, work environments, about being what I think is called COVID secure or COVID safe, and taking the normal precautions. It seems in these days really obvious, but what are the normal things that individuals can do to stay safe?
So I guess it's the stuff that we hear repeatedly on the TV, we see on billboards. It's really good hygiene, so hand washing regularly, hand wash before you eat, wash your hands when you come in from outside, the use of the hand sanitizers, wearing a face mask, and keeping your distance from other people. Most schools are working on the principle of bubbles. Mm-hmm. And so it's keeping your distance from other bubbles within your school. So those are I think the three standard pieces of advice. But then I would recommend going a little bit beyond that, which is also asking your community, because I think we're all advised on the news, but we can do our little bit to help reduce transmission in our area by asking our friends and family to adhere to these things as well. And just, I think it's one thing them hearing on the news from someone they don't know, but if we remind our friends and family that there are people among us who are more vulnerable, and that's why it's important for everybody to wear a face mask when they're out, to keep their social distance, to wash their hands. I think the other thing is that we can encourage our friends and family and our community to engage with test and trace.
Yeah.
So if people have symptoms, they should get themselves tested, wait for the results, and if they're told to isolate and share their contact details of people they've been in contact with. And that way, that will dampen transmission in people's communities. And I think schools can help with that if they try and mention this in assemblies and remind the other pupils that actually, although they feel fit and well, some of their friends might not be.
Just taking a little bit further, because we talked about school and those sorts of things. What do you think? And we've had questions, and we've seen it on Facebook pages and that. What about doing sort of family things like going for a meal or something, a birthday bash or something like that? I know in the restrictions of 6 in a group and things like that. Going to a restaurant. What would you be saying there, Shahin?
Yeah, I think everybody's going to make their own determinations of risk and benefit, and I think as you alluded to at the beginning, there is no absolutely zero risk. You can't get rid of all the risk altogether, so you've got to find the right balance for your life.
Yeah. Just to try and sort of start moving towards a closing, because I know you're a very busy chap. Is that we're coming towards? Unfortunately, we're coming towards the sort of winter months, and the media's full of all. It's got to be said, doom and gloom sometimes about, depending on what you're watching, but the winter months and all these sorts of things. And you've touched on about, if you're symptomatic, you've got a cough and a cold, then treat it like you described. Second wave and things like that. What advice again, or words of not just comfort and things like that, but true sort of advice about will it get worse? Will it get better? I know that's a really big question, Shahin,
Yeah.
but do we do something different in winter than we've done in the last 6 months, which is during the summer months? More challenges?
There probably will be more challenges. I think we can't be ruled by fear, but we should be vigilant. And I think actually most families are, every winter they're a bit more vigilant of coughs and colds, even before coronavirus came along. We can just see the case numbers going up. We can all see, I don't have any additional special knowledge over that, but I think everybody will need to be vigilant of what the advice in their local area is and what the case numbers are. As winter approaches, we have always recommended flu vaccination for our patients, right. And I do want the patients to engage with that again, and I don't want them to be scared to go and get their flu vaccines.
What about Shahin on that one? Because what about, so the individual gets the vaccine? What about people who live with them? Is there any, if you live in a family with some who's clinically vulnerable, and in this case we're talking about children with PH, should the rest of the family get the flu vaccine this year, do you think? Or is that, because there's mixed messages being floating around?
Yeah, so I'd hate to add to the confusion. We've normally recommended, and perhaps on less science, that the family gets flu vaccines. It's fortunate now that school-age children get them anyway, so yes. Siblings tend to get them. And now it sounds like the whole flu vaccine program will be expanded. So actually, most people would almost automatically be eligible anyway, I think. But I do think it makes sense to get a flu vaccine for everybody in the household.
Yeah.
And apologies if that causes more confusion.
Good, good, good. So it's been good to speak to you. From a word of thanks from the PH community, particularly to all the team at Great Ormond Street for everything that you've done, and I'm sure going to do for the next, because we're certainly looking for the next 6 months. Being realistic till anything like a normality would be there. But I mean, I'm very hopeful that when we get back to something like business as it was, that it be business that's better than it was. And you know, we've learned, so we are, and we continue to learning so much through this episode about, you know, how to support and manage people with conditions like pulmonary hypertension. Because one of the challenges we've got with this is the geographics. You know, you're providing a service that covers the whole country, and the geographics are very sort of challenging as well. But maybe the new technology is the one that's thrown the spotlight how we can use that. How we can use that better. So many thanks to you, as I say, and just give a huge thanks to the rest of the team, the nursing staff, the clerical staff, and everybody else that's sort of down there at Great Ormond Street. We'll continue to think about, you know, we may have another chat around Christmas time.
Christmas chat, yeah.
Christmas chat, because I'll come as Father Christmas, because I'll not be able to sit on Father Christmas's knee, but I'll come as Father Christmas. But it might be a good time again, because you know, it will be the next few months will be sort of challenging, as you say. But we have learned so much, and it is, let's not live in fear. Let's not live in fear on this, that we will get through this, and we are getting through this. We're in a much stronger position than we were in June and things like that. But we've got these sort of increasing numbers, and all that causes worries and concerns. So many thanks, Shahin, for your time.
I want to thank you, Iain, and the PHA, an enormous source of support for us actually, and all the patients, and to thank the patients who have been really considerate to us, and you know, it feels like we're really working together, so it's really good.